Good morning, ladies and gentlemen, and my fellow citizens from Randolph County. We start our 5th week of these video conferences for you to, again, keep you apprised of developments here in the county and just share a thought with you each morning and to hopefully add something to your day. And as we go through all this coronavirus situation together, we still incurring cases. Thank goodness we had none overnight. Last Thursday when we did our previous video, we had 66, and today we're up to 78. So our numbers continue to grow. We just encourage you to follow the safe distancing, the requirements, the orders that are before us. And I want to say this, I get questioned a lot about what the county's done, what we have in place, and that maybe we could do away with that. We don't have any directives or any orders from the county. We have followed the orders as issued by the governor of North Carolina. Also, a lot of the businesses are imposing their own requirements of safe distancing and limiting people going in the stores as the governor has directed. So we are following orders that are given to us. We can't do anything to lessen those orders. We can only make them more difficult or harder, and we haven't done that. But we're following the state. Some of these orders are set to expire a week from today on April the 28th. And if we can do our part to maybe stop the spike and to slow down the numbers, then maybe some of those orders will be lessened for us as we go forward. I know patients are wearing thin. Some of the other things we see as we talk about the coronavirus during this process. Alcohol sales has gone up substantially. Domestic violence has increased. The rate of divorce has increased. So those things are sort of side effects from what we're going through with the virus. So we're in this together, and we just encourage you to do everything you can to get us out of this process so we can have some normalcy to our life, and so we can go to the grocery store on any day and buy a roll of paper towels or toilet tissue. So with that, you will hear this morning from a couple of our nurses who have been on the firing line here in the county and back here in our operations center for the last several weeks. And they're going to give you a first-hand view of what's going on here and some of the things that they deal with every day in this crisis. So with that, I want to leave you with a thought today. Thomas Chisholm was born in Franklin, Kentucky in 1866 at the end of the Civil War. He had a great desire for learning. And in fact, at the age of 16, Thomas Chisholm was himself teaching school. In 1893, at the age of 27, he gave his life to Christ, and he was converted. In 1903, Thomas Chisholm became an ordained Methodist minister, but his ministry was cut short by a serious illness that would bother him for the rest of his life. He soon left Kentucky and went to New Jersey and started a life in selling insurance. And you might say, well, who was Thomas Chisholm? What did he do? Well, Mr. Chisholm had another quality. He had a great ability to write poems. In fact, in his life, Thomas Chisholm wrote over 1,200 poems. And in 1923, at the age of 57, one of his poems was put to music and become an anthem in Christianity and gospel music to this day. Probably in churches in every part of the world, somewhere this past Sunday, this song was sung. It was a part of a worship service. And the title of the song is "Great Is Thy Faithfulness." And if you have a chance to look it up and read the lyrics to that song, maybe you have a songbook with it. But the chorus of that song says, "Great is thy faithfulness, great is thy faithfulness. Morning by morning, thy mercies, new mercies I see. All I have needed, thy hand hath provided. Great is thy faithfulness, Lord, unto me. And the inspiration for that song itself came from Scripture. And we find that in Jeremiah, the 3rd chapter, and the 22nd and 23rd verse. Jeremiah is speaking to the children of Israel and reminding them of God's mercy and His faithfulness to them throughout their history. And those scriptures read, "It is because of the Lord's mercies that we are not consumed, because His compassions fail not. They are new every morning. Great is thy faithfulness." So this morning when we all got up, we had a new day of God's mercy and God's faithfulness in our life. I know the last couple of times I've done these videos, we've talked about our faith and our hope, but that's all a part, and more important is God's mercy and His faithfulness to us. And He has shown that to us all through this process. Our numbers are nowhere near what was forecasted to be a month and a half ago, and we are blessed and all as we go through this. And God's faithfulness is renewed to us, and His mercies are renewed to us every morning. So I wish you the best, and have a good day and a good week. And you will follow, others will follow this morning with their presentations to you. And God bless the citizens of Randolph County. Thank you.
Good morning. Susan Hayes, Randolph County Public Health. Today our current total of cases is 78. Sadly, our deaths are 2. But that's could be worse. So I want to thank you most of all, because I know it's been emotionally hard. I know it's financially hard to maintain social distancing. I also know that had you not been as supportive as you've been, that the number of cases that we've had of COVID-19 would be much higher, and the number of deaths that we have would be much greater. So thank you. I also want you to know that our public health team is deeply committed to you and our county. In a few minutes, you will get to hear 2 of our frontline staff, 2 of our nurses, who will share what they do to keep you safe every day in this coronavirus outbreak. I also want you to know, as your health director, I have no political agenda. Politics do not belong in public health. My only agenda is the health and safety of my county, the county that I've lived in for more than 50 years. My husband was born and raised in. I've raised my children in. I love Randolph County deeply. Thank you for all you are doing to keep everyone, you, your family, and your community safe. Please take care and stay safe.
Hello, this is April Wilburn, the Director of Nursing with Randolph County Public Health. Today I'm going to discuss contact tracing with you. Part of our investigation includes identifying contacts. Our steps include encouraging persons who have had close contact with a confirmed case or a person with a respiratory illness to stay home to the extent possible and monitor their symptoms. Identifying contacts who have been around the patient 48 hours prior to symptoms starting, those who live with the patient or have been in contact with the patient at the start or after symptoms appear. Assess the risk level, discuss restricted movement based on the risk level. Inform contact. If they begin to experience symptoms, they need to contact their primary care provider. Public health reviews the patient potential exposure by discussing travel, contact with a confirmed positive COVID-19 case, and/or being part of a known COVID-19 cluster. Public health monitors patients by the following. For patients isolating at home, public health will maintain close contact to monitor the patient's condition. If the patient is in the hospital, the infection preventionist will contact public health on discharge of the patient, and public health will determine if the discharged patient still needs to be isolated. Identifying close contacts and staying home helps prevent the spread of COVID-19.
Hello, my name is Dana Wright, Preparedness and Communicable Disease Coordinator for Randolph County Public Health. Today I'm going to talk to you about what happens when we get a positive coronavirus or COVID-19 lab. First, the lab or the physician's office will call us with a positive lab, or it will fall into the North Carolina Electronic Disease Surveillance System. This is a secure online system that allows healthcare workers to input data so that state can see what's going on at the local level. Then we'll review the lab to make sure that it does in fact meet case definition. We'll move on to the patient's name and address and ensure that they are a Randolph County resident. If not, we'll move it on to the appropriate county. Then we'll ensure the patient has been notified of their positive lab. We will either notify them or their physician's office will. Once we notify them of their positive lab, we will isolate them either in the home or the hospital. We'll implement control measures. We will do a home care guidance and assessment needs with them to make sure that they have all that they need to stay in the home and be a safe place to improve from COVID-19 symptoms. They'll remain at home and isolate themselves from others who live in the home. They'll isolate in home for 14 days and monitor their symptoms. A Randolph County public health nurse will call them twice a week to assess their needs and their symptoms. We will determine if the place of work that the patient works at falls into a high-risk category, such as long-term care facilities, congregate setting, or healthcare worker.
Thank you to our Public Health Director of Nursing, April Welburn, and Public Health Communicable Disease Coordinator, Dana Wright. These two professionals are among the dedicated nurses and staff of the Randolph County Public Health Department's front line during this time of coronavirus pandemic. And thank you, Commissioner Chairman Darrell Fry and Public Health Director Susan Hayes, for your comments and your updates. Every minute of every day, somewhere in Randolph County, a county government representative is interacting with a citizen, and information in any time of crisis is critical. Today's video has been the 8th in a continuing series of informational videos presented by your Randolph County government. To date, these YouTube videos have received over 13,000 views, not counting shares, and we sincerely thank you for that. Our next COVID-19 video is scheduled for this Thursday, April the 23rd. They're usually posted on our website around 1 p.m. Our featured guest Thursday will be Dr. Kenny Sharon, Director of the Randolph County Cooperative Extension Service. Dr. Sharon will provide information to our agricultural community, which, by the way, is Randolph County's largest industry, on impacts expected as a result of the coronavirus pandemic. Thank you for being with us today.